Hello, good morning, good afternoon, good evening, whatever time it is that you're watching this. Bentley is looking out the window over here. Hey, want to say hi? Yeah, want to say hi? So, how are you doing? What are you drinking this morning, or today, or while you're watching this? I am drinking my typical London Fog with the Peak Tea Miss Ray, the version of Earl Grey, with organic steamed whole milk with water, boiling water, obviously. Um, Organic vanilla and organic stevia. Speaking of organic stevia. Mm. Now, interesting enough, if you kind of like the vanilla taste, but I know vanilla is vanilla is expensive to begin with, but I know it's expensive, like even more expensive now. Um, Stephen Smith has this tea called Black Lavender, which has vanilla in it, and it's interesting because I can literally steam my milk, put it in there, and just add some stevia, and it tastes it don't taste the same, but it kind of tastes similar. So it gives a different punch to a London Fog. So it's really interesting. So if definitely you want to try that route with the without having to do the vanilla. Anyways, so happy first day of September. Happy Labor Day. It is September is also Ovarian Cancer Awareness Month, hence the teal butterflies back here. And it's also Pancreatic Cancer Awareness Month. Now, ovarian cancer has significance to me for a couple of different reasons. One, I had an aunt who had ovarian cancer, and I lost her to ovarian cancer. That was really close to me. She was like a second mother to me. She was my mom's brother's sister. My mom and her were really close. So, in turn, like I was really close with her as well, and my uncle. But so that my mom definitely supported her through that, as well as, and then of course, obviously my uncle after she passed, and there's people walking outside. We have where we're at. We sit on a community college's land that's built on a community college's land, and they have like some woods and trails right behind us, and so people let their dogs run back there with not on a leash, even though it's not a dog park. So Bentley likes to sit out the window and look at them and bark at them. So, or when people are walking by, he'll do that sometimes too. But there's two doggies out there playing right now. So, anyways, and then too, of course, my most recent, I had somewhat of a small scare, though, and were benign masses on my uterus, and the other one was a teratoma on my ovary. But there was also the one on my uterus that they were very concerned about because it was both a solid and liquid. And it actually started attaching to my bladder, interesting enough. So, anyways, but everything came out benign. I'm fine. So, small scare with that. But yeah, with my aunt, it definitely holds close to me. And now, pancreatic cancer. My uncle, my mom's oldest brother, was just diagnosed with pancreatic cancer. So, yes, I feel like I'm collecting cancers here. Morbid sense of humor. I remember during the comedy one, I talked about how we have morbid sense of humor as you gain them. Never lost mine since my parents and I gained ours with my mom. But yeah, so the teal butterflies, really cool. There's this organization called Teal Butterfly. You can go to their website, tealbutterfly.org. Their website is actually in the description of the show. if you want to go, they do what they call the butterfly challenge, where you paint your nails teal. So that's what I know. And then you take a picture with them, paint it teal, like in the shape of a butterfly. And then you post it on social media with the hashtag Teal Butterfly Challenge. But you also list the symptoms of ovarian cancer. So it brings awareness. It helps bring awareness for ovarian cancer. All the information and what you should do is on their website. Just go to the link. It's in the show description. It's on the first page. If you scroll down, it says take the challenge. Click on it. You also see some pictures of other people who have done it. Bentley and I typically do it because it's his Instagram I posted on. So yes, Bentley has Instagram. Bentley brings you happiness. It's his handle, but we posted on his Instagram, so he normally takes the challenge with me for that. So yes, we will be doing that. So hopefully you guys will do that with me. Hopefully. But they also have other things on their website shop. So you have these butterflies that you can hang in your shop, or you could sell them for $1 and turn around and donate the money if you wanted to. They also have pens, a couple other things, but their organization, they raise awareness for ovarian cancer. They have a couple of fundraiser events that they do that are really cool. But what other things they also do that they don't mention on the website is they do like these butterfly bags where they go to the cancer center in their city, and they donate butterfly bags, or donate these bags with they have like port pillows that you can wear for where your port is. When you put your seatbelt on, you put it on the seatbelt, and so you can have this wear your seatbelt properly over your port, but the port pillow softens it so it's not right on your port. And then they have other goodies in these bags for ovarian cancer patients that are going through chemo. So what they do is amazing. Definitely check them out. I love how they came up with the name of the challenge is awesome. That story's in there. I've spoken with one of the co-founders, and she's always been amazing. And whenever I've reached out to her for a couple of different things. So definitely check them out. If you're in the area of any of their fundraising events, go for it. They have one coming up in October, the witches, I forget what they called it, but it's really cool, interesting. I love Halloween, so I think that's awesome when they do that. So yes. Anyways, so definitely check them out. Onto onto what we're going to talk about today. So healing through oncology massage. So oncology massage, it serves as an integrative therapy that helps reduce side effects of chemo and radiation treatment. Some of the physical benefits is it reduces pain. So it can alleviate both chronic pain and pain associated with surgery, chemotherapy, and radiation. It can lessen your fatigues. So studies have shown that it can effectively reduce cancer-related fatigue and improve energy levels, which is a really good thing. So when my mom was going through this, and this is kind of how I learned about oncology massage, is when my mom was originally diagnosed, I wanted to give her a massage, or get her a massage for her to kind of relax. And nobody would take her because she had cancer. So this is when I learned about it, and the whole concept of this organization came about. And so one of the things was I wanted her to relax, but also too, even when my mom went in remission, she never truly recovered. And I say that in a sense of her energy levels were never back to where they were before. And then of course throughout the years she started having different side effects from the radiation treatment, which to no fault, like I'd much rather have my mom and help her go through those things than not have my mom and not have those done. But the point being, like, if this is something, it's definitely something worth looking into, even if it's just for helping you improve your energy levels, because cancer fatigue is like it's very different. So it can also give you relief from nausea. It can help you sleep better, which is really good. I know you have nightmares with everything that goes on. You do, your loved ones do. I know both of that firsthand. So yes, it helps you sleep better. It can also improve circulation. So gentle massage techniques, such as like the sweetest massage, can enhance blood flow. It can also, manual lymphatic drainage, MLD, it can help with that. So a specialized light rhythmic massage can help manage lymphedema and swelling caused by lympho fluid buildup after lymph node removal or drainage. So this is one of the reasons, especially if you're experiencing this, it's important to have a certified oncology massage therapist. We'll get into that in a minute, but just that's like one of the main reasons it's important to do that. I wouldn't have just a regular massage therapist do that. Decrease neuropathy. So those with chemo included peripheral neuropathy, so nerve damage. Regular oncology massage may significantly reduce the pain, numbness, and tingling for that. It also has emotional benefits, so it can help lower anxiety and depression. So remember in the previous videos when I talked about, like, if you're stressing over and worried and concerned about what is going on with your body, what it may, what's to come, then your immune system is not doing what it should do. If you're taking chemo, it's already compromised, but that doesn't mean it can't do what it needs to do, if that makes sense. So it's just, when you're going through anxiety, depression, it's just adding more onto your immune system, to adding more work for your immune system, basically. So it also gives you a greater sense of well-being. So it can help you reconnect with your body and feel more relaxed and in control. Now, some people before they're diagnosed have a great connection with their body. They know a lot about their body. A lot of times you do and you don't realize it. But sometimes when you have, when you get cancer diagnosis, especially if you felt like you've done everything right, like eaten well, you've exercised, all of that, and it still happens, you still get cancer, you still get, sometimes you can feel like you're betrayed by your body. You can feel that. Some people do. Some people feel like when you're diagnosed, even though the cancer could have been in your body for many years, when you're finally diagnosed with it because those symptoms shows up, then you all of a sudden you're like, I need to get this out of my body. Like your body kind of feels foreign to you a little bit because you have something foreign in your body, even though you have to stop and think that, yes, sometimes another month can make a difference, but at the same time, if it's been in there for years, then what difference is a month going to make to some degree? And it can, I'm not saying it can't, but at the same time, sometimes depending on what type of cancer you have to look at it like that. Other times, some cancers, you can't look at it like that. Sometimes it needs to come out immediately. You don't have that month. But Anyways, but a massage helps you connect to your body, helps you to reconnect with your body. It also gives an emotional release. So it can help you process difficult emotions and experience and important emotional releases. So, and so I kind of say this kind of goes hand in hand with acupuncture a little bit, or even acupressure. Sometimes you've seen those videos or things. I don't know if you have or not, but you'll see some like people are fine and then they go and they'll do acupuncture, and then all of a sudden they're crying because it just releases something they've had built up inside of them. So kind of the same thing with like massage therapy, because it's massaging that, like you're getting it out of your system, so to speak. And so similar thing, at least from my perspective. You may have a different perspective, and that's okay. That doesn't mean you're wrong on your perspective with it. So, but what do you need to know about finding a certified oncology massage therapist? This is the most important part of this video. If you don't take anything else from this video, please take this from this video. Oncology massage is not the same as traditional massage. A qualified oncology massage therapist has specialized training to adapt techniques for unique needs for cancer patients. So, a certified oncology massage therapist is someone who has completed specialized training, typically through CE or continuing education, to provide safe, modified, and comfort-oriented massage to individuals with cancer. And it's really important that they do this because, as we all know, things are constantly changing in oncology, like with cancer medications and with different cancers, and people are finding out different things. And this is how they learn about it. As you know, my husband's an emergency veterinarian. He has to do CE. Granted, each state has their different qualifications every year, or different qualifications where he has this license. He has this license in a couple of different states. And so there's one state where he has to have so many trainings or so many CE credits every year, whereas he has to renew his license every year. Whereas in another state, he has to only renew it every other year, or in one state, and basically the same thing every other year, but one that ends in odd, one that ends in even numbers or whatnot. So because he has his license in the one state, he has to have it every year. So he does CE every year. And this is how you learn about anything new, or if someone is teaching or doing a session on something specific, they talk about their experience and things that they've had or things that they've run into that may be different than what you know or learn, because medicine is ever so changing. So yes, as well as like cancer, the disease is ever so changing, and we're learning more and more about it every day. Now, see people, they go through like this very detailed type of cancer, that they have. And I'm sitting here like, this wasn't the case when my mom got lung cancer. People were talking about like 1H3 or whatever. Not saying that's real, but just making up off the top of my head. And when my mom got lung cancer, it was either small cell or non-small cell carcinoma. And that was it. So, and that was back in 2006 and 2015. So a lot has changed between 10 to 20 years. And so we're getting more specified. And so this is how I say that in the sense of you want to make sure that someone who is certified in oncology massage is going to the CEs. They're getting this because this is how they learn, right? So, and how they get updated on new things that are coming out. And same thing with your doctors and your oncologists as well. So also too, a certified oncology massage therapist understands how to work with side effects medical devices like ports, and specific health precautions. So, with that being said, risks to be aware of. And so, just like I said, if you don't listen to anything else in this video, please pay attention to this part of it. Remember, so kind of the same thing with acupuncture. You want somebody that's familiar and worked with cancer patients, because they could do harm without intention, not realizing if they don't know what is, what, I don't want to say what they're doing, if they don't know how to proceed with someone with cancer. So a risk to be aware of: deep tissue massages. This technique is often too vigorous and should be avoided due to the risk of bruising, especially with chemo patients with low blood platelet count. So remember, I mentioned the sweetest massage because that's more of a light touch. There's not a lot of deep tissue going on, but you don't want to do deep tissue massages. Blood clots. Vigorous massage can potentially dislodge a blood clot. So massage is avoided if you have deep vein thrombosis. Infection. If you have low white blood cell count following chemo, you are more susceptible to infection. Massage therapists should avoid massaging over open wounds or areas with skin breakdown. Now, each oncologist is different. My mom's oncologist was amazing. Again, things could have changed between now and then. This is something we're starting looking at back then. I don't know, but I do know my mom's oncologist, before her chemo sessions, would send her to go get the Neulasta shot. The Neulasta would put her white blood cells kind of like, I don't want to say off the chart, but make them really, really high, because then when she got her chemo, they were going to, when they went low, they wouldn't go below normal, if that makes sense. So she, is very interesting. When we had a Siberian Husky and she had gotten cancer, and when we decided to do chemo, I was like, let's do I can't remember what it's called, but the veterinary version of the Neulasta shot. So, and kind of how, and we did her, she only did she ended up doing, I think, 2 rounds of chemo, and they were or 2 rounds of infusions, but they were kind of within hours of each other. So I was actually with her at the hospital because she was hospitalized during this time. But we did the protocols and things that my mom's oncologist did with her. That's what I kind of did with our Husky, our Siberian Husky, because, she was a finicky eater, and so already as a Husky, and so we, it was like, let's do before we do the chemo, let's do an appetite stimulant, let's do, the veterinary version of the Neulasta shot. It's called something similar to that, and I can't remember what it's called, but it was like, let's do that. So kind of the same thing what my mom did, and an anti-nausea medication for her, all before she got her chemo, and then she got her chemo. So we never really had the issues of her eating with it as well, and she was as comfortable as she could be receiving chemo. So anyways, so yes, anyway, if you do have low white blood cell counts, do not do the massage therapy, or make sure you're discussing it with your oncologist and a certified oncology massage therapist. Also, if you have sensitive skin, so radiation therapy can cause skin irritation, and that area should be avoided or massaged very lightly through a soft cloth. So I actually found this really great thing for radiation therapy. We'll talk about that probably next week. But yeah, I mean, that depending on how it is, like it can be really bad. Like it can burn, it burns your skin, obviously, because there's radiation going on that spot. But sometimes, depending on each person has a different reaction to it. Your skin has a different reaction to it. So yes, that can be very sensitive. So if you are getting the massage, just make sure they know about it. Again, if you have a certified oncology massage therapist, they would know that, or know not to do that, because they would ask for that. But again, only a therapist with specialized training in oncology massage um, should should prove should prove understanding which techniques are appropriate and how to modify them for your safety. Um, so, such as avoiding massage directly over tumors, radiation sites, recent incisions, or implanted medical devices such as ports. And it's also important for you to know this, so that if somebody says they're a certified oncology massage therapist, like, you'll kind of know what to look for to know if they are appropriately certified, if that makes sense. So yes, but all of that, keep that in mind, not to scare you away, just to be safe. All right. Where can you get certified oncology massage therapists? Cancer institutes are doing it. I think it's a little bit more popular now than it was then, because I know they had just, what was it? Maybe 15 years ago. I think they just started 12 years ago or whatever. They just started putting, having them into the Cancer Institute as integrative medicine or treatment. So again, Cancer Institutes, a lot of times, unless they've added more certified oncology massage therapists, which I think there's actually more people or more massage therapists certified in oncology massage now than there was back then. So hopefully they've gotten more people in, and the waiting list isn't as long. But I know at the time when they started getting in, the waiting list was so long, a lot of people were not able to get, again, they were finished with their treatment before they were able to get into the massage therapist. So yes, again, check with your cancer institutes. There is an organization called Society for Oncology Massage, S4OM. The website is in the description of the show. You can go to them. You can find certified oncology massage therapists in your area. Now, granted, these are people who are registered through them. So you could come across an oncology massage therapist that you might not find on their website. But, these are people, to kind of give you an idea, these are people that are registered through them, and they actually do it throughout the world too. So if you're in another country watching this, definitely, you can get use out of that website as well. Also, there's another one, Tracy Walton. She is a research writer, award-winning educator, and specializes in massage therapy and cancer care. Her website is in the description as well. Definitely check out her website. She actually goes through... If you know a massage therapist that wants to do this, or gets more experience and certified, or quote unquote certified in oncology massage, this is one way they can do it. Definitely pass her information along to them. But you can learn a lot about what to look for, or even to, or you can even have she talks about, you can have a loved one or a caregiver to kind of give you massage. So in that case, it doesn't necessarily have to be a deep, well, you don't want it to be a deep, but just touching, rubbing on the back, rubbing your arms, a back rub more so than a quote unquote massage per se. And a lot of times that helps so much with everything going on. Or even think about when you go to the hairdresser, one of my mom's favorite things, she ended up before my mom passed, for a couple of years before she passed, she ended up going to my hairdresser. And one of the things that she loved the most about our hairdresser is like she gave like the best head massages. Oh my God, they were so nice. And that was like my mom's favorite thing about going to see her. And think about even just getting a head massage. Like, it takes your mind away from everything and you're like relaxed. So even with like a loved one or caregiver, just like rubbing their back, like having just having your back rubbed or your arm rubbed, and just the feel of that, or rubbing your hand, or just like your face, when people do that like to your face, especially, if you're someone who likes massages and who likes that. I mean, there's some people who don't, and that's fine. If you don't, there's nothing wrong with you whatsoever. If you don't, you don't. That's where I would say, hey, look at the acupuncture aspect of it, or acupressure. Though acupressure is still more touching versus acupuncture, where it's the little small needles. But yeah, just definitely, or even try like one of these massage things. So you can just slightly, no pressure, just slightly like rub down their back. And, so they may, if you don't like being touched, you might, try one of these or see how you feel about something like this, and have somebody just like, kind of rub that down your back. And again, like the whole point is just to, make you feel better and relaxed. And when you're not, and get your mind out of everything that's going on, because when you're not stressing over what's going on, again, it's not adding extra work to your immune system. Your immune system's already in overdrive with what you're dealing with. This isn't adding that to it. So when you're not stressing over it. All right. Well, thank you for watching. Please leave in the comments if you do get a massage, like what do you like about it? Or if you have a certified oncology massage therapist that you go to, definitely, put them in, put their names and stuff in the comments, and like location. So like so-and-so out of Charlotte, North Carolina, or, or whatever. So they know that, so if somebody in that area would know, hey, maybe I need to look this person up. And yeah. And to just, call around and enjoy. All right. So until next week, I'm sorry I went a little long today, but it's a lot. And two, I want to make sure that, not only are you aware with what's available to you, you also need to be aware of, the risk and what to look out for as well. Because we want you safe. We want you to respond as well as you can to whatever treatment plan you have decided to take. And we want you to be relaxed, most important. All right. So until next week, take care. Thank you for watching. If you find this helpful, please share, like, subscribe. It's free to subscribe to. And we will see you next week under the willow tree.